We're going to, pending no objection, be limiting debate to 2 minutes for each person at the microphone. And certainly we can adjust that along the way if we need to further. And with that, I'd like to, and that doesn't apply to the incoming president's speech.
Go as long as I want.
And with
Hopefully
that,
you're optimist and wants to finish early.
I'd like to invite Dr. Nari Heshmati to the microphone.
Okay, can everybody hear me?
Yes.
Fantastic. Good morning. First, I want to recognize my family that's here. I've got my wife, Catherine, and my son, Robert, and my daughter, Serena. Because you can imagine, we were all up late last night, so for the kids to be able to get up, be here at 8 a.m., that's huge. So I'm going to give them a little round of applause. So, it is a pleasure to be here in Bellevue with you for the opening session of the 2023 meeting of the House of Delegates. I'm honored to be standing here and look forward to our usual robust debate and policy making. And everybody remembers how that goes. But first, anyone remember where you were on New Year's Day in 1980? Well, there might be some stories I want to hear later. Well, to be honest, I don't remember either, because that was the day I was born. I know. In Iran. So, for those of you who were of age in 1980, you may not recall that particular New Year's Day, but I bet you do remember the drama of the Iranian hostage crisis that was going on during the Iranian Revolution. I entered the world in the midst of that upheaval. I can only imagine the fear my mom had, feeling along with her contractions. You know, even as she labored to deliver me, our family's homeland was being ripped apart by war. It was day 59 of the hostage crisis. Politics were making life dangerous. And my dad, an orthopedic surgeon, a doctor, like all of you, knew we wouldn't be safe there for much longer. That year, we fled our homeland. We left everything behind, crossed a good many borders, and in due time, we made our way to Florida. And through hard work and some minor miracles, my dad reestablished his medical credentials, became a beloved pillar of the community, and set up our family for success. Now, seriously, can you imagine planning a daring, life-threatening escape with 3 young children in tow? I mean, it's hard enough to travel with young kids. And you have to leave everything behind. If you're lucky, you escape with your life. And we did. But I'll tell you, a lot of people died. A lot of people committed suicide. It was a terrible and frightening time. But through it all, my parents were optimists, and they are my inspiration. I once asked my father about that time. You know what he told me? He said, "America is the land of opportunity. Where else can you go, reestablish, make a life, and be welcomed?" My father always stressed that despite things being difficult, we were fortunate. We had a privilege to escape and come to a land of opportunity. He taught me, both in words and in action. Don't let the negative get in the way of recognizing when you have an opportunity. And so we were welcomed in Florida. And I know that's a long distance from Washington. My parents remind me of that often. Does anyone else? My mom will actually call me periodically, and she'll say, I want to let you know that we're still alive. Because, you know, you may have forgotten, I haven't heard from you, you haven't visited. You know, it was pretty much destiny that I would go into medicine. My father, my uncles, my brother, they're all doctors. My mom, my sister, psychologists. And Florida was a great place to grow up and to follow my dad's example of becoming a physician. I literally grew up playing with toys in my dad's medical office. When I was 10 years old, my dad paid me to set up electronic insurance billing for him. Before that, you used to have to mail everything in. So imagine how bad it is now, like it was even worse. Seriously, I was that nerdy of a kid that I set that up for him. And I charged him for it. Do you remember, we used to send those things in, do you remember the screeching sound of the old 2400 baud modems? I'll never forget those sounds. You know, at that point, half the room here recognizes what I'm talking about. The other half of the room thinks I'm crazy. That optimism and that example of my parents inspired me then and now. You know, they lived out their optimism with the belief that no matter what the challenges are, we have the ability to affect change. My parents are the reason I'm able to stand here today looking at you serving as WSMA president. Inspired by my dad, I went into medicine for the same reason you probably did. Because you want to make a difference. We want to take care of people. But to do that, we need the right ingredients, the right rules, the right system around us. You know, if we're not at the table help guiding that process, that's when we start seeing the things we don't want, the increased administrative burdens, rules and regulations that don't make sense, you know, policies, interference with our relationship with patients, all those things that make it harder for us to take care of people. Healthcare is a dynamic and changing field. We have to be there to make it change in a positive direction, to make sure that at its core, it continues to help care for communities and keep patients healthy. We have significant power when we come together. Our patients and our communities are counting on us to be their voice to impact how healthcare is delivered. My father also instilled in me the notion that we have an obligation to improve our communities and that access to healthcare is a right. Now, back in his day, not everybody agreed with that concept. As director of the health department, my dad made sure and worked tirelessly to identify care gaps and create solutions. Every child in our county, they had access to immunizations whether they could afford it or not. When OBGYNs stopped seeing patients who had Medicaid because their malpractice rates were soaring and they couldn't afford to do so, he actually found a creative way. He partially employed them at the health department, covered their malpractice in exchange for them seeing Medicaid patients. He always found a way to make sure people were cared for. Now, I'll tell you, when we sit there and we look at this, I am not so optimistic that I'm seeing this through rose-colored glasses. I'm optimistic because of all of you sitting here in front of me. We suffered our way through the pandemic. We watched how it strained the system and how it impacted our communities. We focused on keeping our communities healthy despite those obstacles. When we had to close our practices, we pivoted to telehealth. When we ran out of PPE, we made our own. When critical lab products and medical equipment dwindled in supply, we found alternatives. The public called us healthcare heroes. All of you were and still are heroes. I think that bears repeating. All of you were and still are heroes. As we exited the pandemic, we were reminded that the challenges facing healthcare, they didn't go away. They worsened. Deaths from cardiac disease skyrocketed. Maternal outcomes digressed, especially in our most vulnerable populations. According to a recent Medscape survey, some of you might have seen this, 53% of us feel burned out. 23% of us are depressed. Medscape appropriately, but sadly titled it, "I Cry, but No One Cares." I know we are facing complicated problems in a complex system, but I also know that we have to make it better. Because otherwise, it's going to impact the care our patients need, the care that we're able to give, and I believe we can make it better. We have challenges. We've lost trust from the public. We've got physicians and physicians' assistants who are burned out, frustrated, even thinking about retiring at younger ages. We've never seen it this bad before. We have to make the system better because you don't have a healthcare system if you don't have physicians and PAs in it. We have to preserve the sanctity of evidence-based medicine so patients can receive the care they need without interference, hurdles, burdens. Patients deserve access to the best care we can provide. We need change, and I believe we can be the change. I believe the WSMA is the organization that can help make that happen. You know, we're the leading voice for how healthcare should be delivered. We're at the table for all of the important healthcare meetings, the work groups, the processes, everything that happens in the state. Never forget, we are the voice of physicians and patients. You know, as I look out into this crowd, I see a lot of familiar faces. Colleagues, friends, patient advocates, healthcare champions. But more than that, I see the team that's going to make Washington the best place to practice medicine and to receive care. You know, we face monumental challenges. These are going to take innovative ideas to fix. And sure, it's a big task. It's overwhelming. But as always, I'm optimistic. You guys are a battle-tested team. You've endured a pandemic, you've navigated regulatory challenges, you've faced economic hardships, and you know what? Every day, you still provide care to those who need it. You guys do not skip a beat. So if healthcare in Washington is the challenge we need, we couldn't ask for a better team. I couldn't ask for a better team. I truly believe in WSMA's mission to make Washington the best place to practice and receive care. My priorities, our priorities, are based on that, just as they have been for years. You know, we have an opportunity, just as my family had an opportunity when we came to the United States, to improve healthcare and not get bogged down in the negative. Just as my father taught me in our communities, you know, this is how we can improve things. And I know each of you have similar stories that call you to action. This work is going to be difficult, but we're going to get through it because we're going to support each other like family, because we are family. And our patients are counting on us. Together, we will make Washington the best place to practice medicine and receive care. Thank you. I'm not going to practice this. Now, as you guys who know me, I take a ton of selfies, and I did promise Milana that I was going to take a selfie up here and I'm going to see if I can get everybody in here. Let's see if we can do this.